Good morning. It's 7 o'clock. I'm Vincent Kasozi. A group of medical professionals has petitioned the government to release Dr. Kizza Besigye on bail to access specialized healthcare. In a press statement, the group led by the former president of the Uganda Medical Association, Dr. Ekwaro Obuku, claimed more than 1,400 medics, including medical doctors, pharmacists, nurses, and allied health professionals, signed the petition for Dr. Besigye's medical release. They say Dr. Besigye belongs to the Elders Forum of the medical fraternity. Dr. Obuku attached a sample list of petitioners carrying the names of 33 medics. The four-time presidential candidate holds a bachelor's degree in medicine and surgery from Makerere University. Dr. Obuku observes that whereas Dr. Besigye is no longer under hunger strike, his body remains fragile. On Friday, Dr. Besigye was brought to the Nakawa Chief Magistrate's Court, frail and unable to walk, as he started the formal beginning of his treason trial in a civilian court. Defense lawyer Erias Lukwago passionate appeal to the Chief Magistrate to allow the ailing Dr. Besigye to seek specialized treatment outside the prison did not succeed. The leadership of the National Unity Platform Party is assessing the recent raid on their offices by joint security operatives. On Thursday and Friday, a search was conducted by joint security forces comprising of the police, army, and joint anti-terrorism task force. The security operation was carried out at the NUP offices in Kamucha and the party's headquarters in Kavule. Acting Major General Felix Klaija, the UPDF spokesperson, said the raid follows videos that have been circulating on social media where NUP members are threatening to cause violence. Doreen Kaija, an administrator at the NUP Leadership School, said the security personnel not only vandalized office property but also took money worth 2 million shillings from the office. Yesterday, the NUP Secretary General Louis Rubongoya said that for the 2 days security was at their premises, doors were broken, computers were taken, electricity and internet wires were also cut, and cameras disconnected. He said the party is going to do proper stock taking to establish the extent of the damage. He said the raid on their offices was aimed at disorganizing the party activities but would not break their resolve. Despite budget constraints, a section of MPs want the government to deal with demands by the teachers to bridge the salary disparities between science teachers and arts teachers. The Uganda National Teachers Union General Secretary Philbert Baguma, when interfacing with members of parliament, wondered why science teachers should be paid 300% higher than their arts counterparts when they all exist in the same economy and teach the same learners. Workers' Member of Parliament Abdul Biakatonda described the salary disparity as illegal, citing Article 21 that emphasizes the need for non-discriminatory rewards and apportioning of salaries. He said it's important for either government to enhance salaries of the arts teachers gradually or ensure that it is prioritized in the budget. He called for calm among arts teachers.
When you talk of development and socio-economic transformation, workers are very key. And when we do that, it's very important. I remember last year, as a country, we transited to low middle-income status. One of the key aspects is education. So if our education system has a lot of mishaps and gaps, it means we shall actually follow back. So it's important really for government to look into this. And once this is looked into, it can actually, you can harmonize gradually, you can do it and ensure that at least you bridge the gap.
The Bokoli Island MP Peter Okeo says this discrimination has demotivated arts teachers.
It has demoralized the arts teachers who are paid peanuts at the expense of the science teachers. So I would call upon the government to make sure that there is a systematic increment until it will come to a level where the arts teachers are also better paid. They may not reach the level of the 3 million paid to science teachers.
In news from across the globe, Pope Francis remains in a critical condition but has not presented any further respiratory crises. The Vatican said in a statement yesterday he was still receiving high-flow oxygen therapy and had undergone blood transfusions. Blood tests also showed that he had initial mild renal insufficiency, a kidney problem that is currently under control, the statement said. The Vatican said he continues to be alert and well-oriented. The Pope was admitted to Rome's Gemelli Hospital on the 14th of February after experiencing breathing difficulties for several days, where he was first treated for bronchitis before being diagnosed with pneumonia in both lungs. That's the news at 7 o'clock. Good morning.